Hi, my name is Winnie. Today I'll be demonstrating how to insert a Foley catheter. The first thing I'm going to do, I'm going to read the provider's order. Order for Charlie Knight. Order for urinary retention. Order for Foley catheter. Now I'm going to the patient room. Knock knock. Hi, my name is Winnie. I will be your student nurse for today. I understand that the doctor ordered a Foley catheter for you. Can you identify your name and your date of birth for me?
Charles Knight, 08/08/1939.
Allergies to penicillin, betadine, latex. Okay, now I'm going to identify and make sure that the patient information is the same information that is on the provider's order, which is Charlie Knight, latex, penicillin, and betadine allergies, and then date of birth 08/08/1939. Okay, now I'm done with that. And then the symptoms for you, I understand that the symptoms are you have not been able to urinate for over 10 hours. So I'm going to assess the area right now just to make sure that nothing preventing me from inserting the catheter. And hygiene. Side well down. Put on gloves. Remove sheet. I'm going to expose it just for a little bit. Okay, now I'm looking at the urinary meatus. It looks clean. No abnormal drainage. And then I'm going to palpate the bladder. Do you feel some pain? Do you feel discomfort?
Yes.
Okay. So I'm going to get my supplies ready and come back. Remove gloves and hygiene. Now I'm going to make sure that the surface is clean and dry, and then make sure that the package is not open. Now I'm going to open the package. Okay, make sure that the package is a 14 French catheter, and then it's not expired, and then it doesn't have anything that the patient is allergic to, which is latex, penicillin, betadine. Going back to the room, like that. Like this. I'm going to put this in place for my trash bag. And then I'm going to fix the patient legs. Expose you a little bit. Get my supplies ready. No, I can put this one because I already identified it. Now I'm going to open my box. I just touched the patient leg, so I'm going to perform imaging one more time. I'm going to open the one that is like farthest away from me. Sorry. That is far away from me first. 1 inch margin. Make sure that I touch like the only like the 1 inch margin. And then I'm going to open second one. I can put this one away and open, close. Now I'm going to fix my start technique. So I have like too much hanging on this side, so I'm going on this side because I don't want to touch it. Okay. So now I'm going to take the blue sheet, step back. I will make sure that I only touch like the 1 inch margin. Step back. And then now I'll take it like to the patient room. Make sure that I don't turn my back to my sterile field. I don't like the way it is, so I'm just going to reach over the patient, not over the sterile field, and fix it. But make sure that I don't touch like the patient legs. Okay, I'm going to pretend that that does not happen. So I'm going to refold it one more time, and we put it back on the bed. Okay. Okay, it didn't happen. So I'm going to open it, step back, open it, only touch the 1 inch margin, go to the wound, go to the wound, make sure that I do not touch the patient legs. Okay, step back, done. Now I'm going to apply my gloves. And I don't like the one that they have on the box, so I'm going to use another pair of gloves. Open it. So I'm going to trash it, make sure that my hands does not go like below my waist. So I'm going to do like my dominant hands first. So pinch it and step back. Step back. So I cannot touch it because this hand is not sterile. So I'm going to put the other one and fix it with the other hand. So put 4 fingers in there. 4 fingers. And then step back. Okay, I don't have to worry about that one. Now I can use this hand to fix that one. I don't need to worry, and then push them together. Okay. Now I can charge that one because I'm not going to use it. So the next thing I'm going to do, I'm going to open my white sheet. Step back, open it. I can touch like this one because my hand is still and this one is still. So take it to the, make sure that I don't turn my back to my stove felt. Okay. Next thing I'm going to do now, I'm going to open my hydrogen peroxide, step back. Put it over the cotton swab, cotton ball. Okay. Trash it. Now I'm going to open my loop. Put it on this side. Trash it. Okay, next thing I'm going to do, I'm going to remove the tip of the plunger. Remove the tip, not the plunger. Exercise my plunger. Trash it. Exercise my plunger. Okay. And leave it on this side. And then I'm going to move this, but make sure that I stay on the stove felt. Don't go over it. And then now I'm going to remove the sheet of the catheter. Make sure that I'll hold it in place. And trash it. And then now I'm going to loop it for about 2 inches. 1 or 2 inches. And then I can put it back. This one. So I'm not going to use this for now. I can put it on this stove film. Okay, so now I'm going to take the insert it to the catheter so I can have everything ready. Okay. So now that I have everything, so I can take them to the patient. Together to the patient. I can move this out of the way because I'm not going to use it. Okay. Now I'm going to open the labia. I'm going to do the side that is far away from me first. Outer, out, inner, out,